The following is brought to you by CHI St. Vincent.
Happy to have cardiologist Dr. Prabhat Hebbar from CHI St. Vincent here, Heart Clinic, to talk about AFib. Now, AFib affects a lot of people. How serious is it of an issue?
So, atrial fibrillation is the most common electrical problem of the heart. The World Health Organization has now designated atrial fibrillation as a worldwide epidemic. We have over 33 million people.
So a ton of people.
Ton of people around the world having atrial fibrillation. If you look at a map of the United States, the highest fibrillation are found in the south and in the northwest.
Wow.
So this is a very important problem for people in Arkansas.
Yes, because we are definitely part of the South. Is it easily diagnosed, and what should people look for when you're talking about AFib? While
atrial fibrillation can be completely silent, most people will have symptoms of palpitations. That's an irregular, fast heart rhythm that comes where you can feel a pounding sensation in your heart, in your chest. The other symptoms you can have include shortness of breath, chest discomfort, and undue fatigue, very unusual fatigue. If you have any of these symptoms, then it's probably a good idea to go and get yourself evaluated by a physician.
Yeah, so how serious can this become if it remains undiagnosed, untreated, if you just think, oh, this can't happen to me? Because a lot of people will get into the, well, it's not going to happen to me type of deal.
If left untreated, this can be a very serious condition because the most serious complications of atrial fibrillation are going to be congestive heart failure and stroke. And since it can be silent, it's very important that you go and get a yearly checkup with your doctor and have him evaluate your heart rhythm and make sure that you don't have an irregular heart rhythm, at which point he can refer you to a cardiologist or an electrophysiologist and initiate treatment.
It's another reason why yearly checkups are so important. Are there specific risk factors that might prompt someone to get checked out? Like if it's genetic, is that something you want to watch for?
Yes, the biggest risk factor for atrial fibrillation is age. As you age, your incidence of atrial fibrillation keeps on increasing. Among Americans aged greater than 65 years, we think the incidence of atrial fibrillation is 1 in 11 people. So it's a very, very common condition. The other specific risk factors that we look at include high blood pressure, diabetes, congestive heart failure, untreated sleep apnea, and being overweight or obese. So these are the other risk factors. Even can lead to atrial fibrillation.
Wow, so a lot of risk factors that can contribute to that. What treatment options are available through St. Vincent where you guys are at?
The treatment of atrial fibrillation can be vary from very simple things like medications to more complex treatments like cardioversion, which is a controlled shock that is delivered to the heart to restore normal sinus rhythm. The other treatments include ablations, and some patients will need pacemakers to effectively control the atrial fibrillation.
Yeah, and so this is something you guys do quite a bit, isn't it?
Our team at CHI St. Vincent's work with the patients to evaluate each individual situation and come with the most appropriate treatment for that patient.
Yeah, so you pick a plan for the patient.
Exactly. We believe in a shared decision-making process where we as physicians explain the condition to the patient. We tell him what his options of treatment are, describe the risks, benefits, and the patient gets to choose which treatment is optimal for him. We also offer a Watchman device.
So that's what this is.
That's exactly right. So the Watchman device is a novel device for patients with atrial fibrillation who cannot take blood thinners. So this is our team of cardiologists, electrophysiologists were one of the first in the state to implant the Watchman device to prevent strokes in patients with atrial fibrillation.
And so this is an alternative treatment for those who can't take the blood thinner.
Exactly. So this is implanted within the heart through a minimally invasive procedure, and it closes off the source of more than 90% of stroke-forming blood clots in patients with atrial fibrillation.
Wow. So this can be an extremely helpful tool that you can use to prevent future issues.
Absolutely. For patients who cannot take blood thinners, still have a substantial risk of stroke in atrial fibrillation, this Watchman device provides a very effective option.
So even if you can't take a blood thinner, all hope is not lost. You do have other treatment options. I guess it just goes, you guys pick a plan that's really specific to the patient.
That's exactly right. And we very hard to make sure that patients have the most advanced options for the treatment.
So if people need more information, if they want to get checked out, where do they go?
For more information, a very good thing is to visit the website. It's called chistvincents.com/heart. There's an entire section dedicated to atrial fibrillation.
Yeah.
There's a lot of useful educational videos in that site. There's also a place where you can actually give your contact information, and our AFib coordinator will call you and talk to you about your symptoms and make you necessary appointments. You can also directly call the AFib coordinator at 552-AFib.